For the first time ever, today's children will have a shorter lifespan than their parents. A major factor for this is the obesity epidemic caused by poor eating habits and sedentary lifestyle. Years ago, children's lifestyles included eating less and moving more. Junk food was not as available and TV was watched minimally. In today's society, children's overall physical activity has decreased significantly. The growing use of computers, electronic games, and decreased physical education in schools all contribute to children and adolescents living a more sedentary lifestyle. Over the past few decades, dietary patterns have also significantly changed. The average amount of calories consumed per day has dramatically increased. Food portions play an important role in the unhealthy diet patterns that have evolved. The prevalence of fast food, supersize options, and all-you-can-eat buffets create a trend in overeating. Combined with the lack of physical activity, children are consuming more and burning off less. The steps necessary to slow down, stop, or reverse the epidemic are far from easy, but success is possible. Hi, I'm Dr. David Tilstra, a pediatrician and medical director at CentraCare Clinic. I am also a member of the medical committee for the BLEND initiative, which stands for Better Living, Exercise, and Nutrition Daily. BLEND began in 2006 and focuses on improving child health by addressing the problem of childhood obesity. BLEND works with schools, youth-serving organizations, local government, and the medical community to raise awareness about good health, increasing daily physical activity, and good nutritional choices for kids and families. BLEND has set a goal of an overall 10% reduction in body mass index, or BMI, in area children by 2016. To assist in achieving that goal, the medical committee has developed tools for healthcare providers to use in their offices to help address the issue of childhood obesity. Our objective is to share these tools with you in hopes that cooperative partnerships might be initiated and all providers in Stearns County will be acutely aware of how they can effectively be part of the solution. The first tool, an algorithm, helps providers address the issue of childhood obesity by providing practical support and guidance. The first step in addressing obesity in children is to track a child's BMI. BLEND, along with the American Academy of Pediatrics and the American Medical Association, encourages tracking patients' BMI on a regular basis. When a child is found to be overweight or obese, you are encouraged to go one step further and implement this algorithm. The second tool of our medical intervention is the development of a prescription for healthy living that the physician fills out and gives to the patient. The prescription includes a space for physicians to fill in when the patient should return to have his or her labs rechecked. It also introduces the 5210 Wellness Program, which is designed to encourage smart eating and physical activity for children and families. The concept focuses on making changes in nutrition and physical activity that can be both healthy and enjoyable. The message is simple and easy to remember. Here's what it means. 5. Eat 5 or more fruits and vegetables each day. 2. Cut TV and computer screen time to 2 hours or less every day. 1. Participate in at least 1 hour of moderate physical activity every day, or 20 minutes of vigorous activity at least 3 times a week. And 0. Consume no sugar-sweetened drinks each day. Let's look at a scenario of how you might want to conduct your next pediatric office visit.
Well, everything looks great. I didn't have any particular concerns. The reason we have you come in every year is for a couple different reasons. One is to make sure that his height and weight is going okay. 2 is to make sure that his development is okay. When we check their height and weight, we also check their body mass index just to give us an idea of where their weight and height is. And today Cameron's body mass index was actually greater than the 95th percentile. And so I'd like to talk about healthy eating habits. One of the big things we discuss is what we say is 5, 2, 1, 0. And these are some nice ideas that can kind of help everybody in the family. So we discuss 5 fruits or vegetables a day, 2 hours or less of screen time, an hour of activity, and 0 calories from sugary drinks.
Okay.
You think you do okay with those things?
I could maybe work on the Xbox, right?
Yeah.
Yeah.
Then we can always eat some more vegetables too, right? So let's focus on those couple of things. Also, because his body mass index is greater than the 95th percentile, the recommendations are for us to do a fasting lipid panel along with liver enzymes and glucose. And so if you could come back in 6 months, I'd like those tests to be drawn before he eats breakfast in the morning. And after that, we can go ahead and just touch base and make sure, see where his body mass index is at that point, and just see how things have been over the last 6 months.
Okay.
So Cameron, I'm just going to write this out as a reminder for you. You can hang it on the refrigerator, and it will remind you of those healthy habits, okay?
Okay, thank you.
Today, nearly 1/3 of children and adolescents are overweight or obese in the United States. That equals more than 23 million young people. By working together now, we can reduce the adverse effects of this national epidemic. We can make a difference in the lives of our children. They need not experience the morbidity and mortality associated with being overweight or obese. You are a key element in the equation to reverse this trend by educating your patients and their parents about healthy living. Please join me and start using these simple tools today. Our next generation is counting on us.